Director General of Health, Malaysia. Yang berbahagia Datuk Subramaniam, Senior Director of Pharmaceutical Services, Ministry of Health. Mr. Tan Angling, Director of Regulatory Pharmacy, National Pharmaceutical Bureau. Presidents and representatives of the various associations from the pharmaceutical, healthcare, traditional medicine industries, guests from overseas, friends, ladies and gentlemen. I would like to thank the National Pharmaceutical Bureau for having invited me to this National Regulatory Conference 2015, which is being organized by the National Pharmaceutical Control Bureau, the Ministry of Health, and the Malaysian Pharmaceutical Society. And I'm glad that there are also people from other parts of the world who are joining us in these proceedings, which I hope will enrich the content and quality of the discussions which will occur within the next couple of days when you're here. I'm told this is the 5th conference organized by the NPCB. The last was held in May 2013. I don't know whether I was there. Was I there? It is the transition period. Whether it's the beginning of May or late of May, I'm not very sure. But this word sounds very familiar to me. I was there? No. Right. So it was the earlier part of May. Earlier part of the May. And this is important because regulation is an important thing. In the pharmaceutical industry, if you go back to the history of drug regulation, we evolved from a time when dispensing was done from the good intentions of the heart, but not from the basis of science. And as those good intentions showed some side effects, then the need for regulations came into being. Historically, as I read somewhere, some time ago, somewhere in 1937, when there was an attempt to give a solution form of sulfonamide drug, sulfanilamide, one of the first generation sulfonamides. The only suspension, the solution which they could think of was a freezer called diethylene glycol, which is still used as a freezer in our fridges. And when that was used, I was told there were 100 over deaths. So that said that the good intention of giving liquid form was courted by this unfortunate side effect of death, which created the need, probably there is a need for regulation. Closer to me is a drug which I prescribe called thalidomide, while managing cases of leprosy. Till today, one of the side effects of managing patients with multi-bacillary leprosy, those who have got a lot of bacillus, is an immunological reaction called erythema nodosum leprosum, or ENL. And one of the best drugs to combat that is still thalidomide. But unfortunately, when thalidomide was prescribed in the 1930s for pregnant mothers because they could not sleep, and they were intention as anxiolytic drug, you know what happened to all the thalidomide babies who were born throughout the world. And these were historical perspectives which probably raised the need for regulations and the need for establishing the safetiness of medicine along with its therapeutic efficacy. It's not an easy thing because over-regulation by denying people of a medicine at the correct point of time. Very recently, there was this issue, an anecdote which I was reading, of allowing aspirin as a drug for the prevention of myocardial infarction for the first time. Because the initial studies of aspirin were done for re-myocardial infarctions, the second myocardial infarction, not for the first one. So when it worked for the second one, of course, simple minds like mine will say, obviously it will work for the first one. But it's very interesting, in the panel of people who voted for this decision, they made a decision saying that because there has been no study done to prove that it works in the first case, we will not vote for it. So when outside the thing, this is mostly, you must listen to this very carefully, the people who voted were asked, they said, as a regulator, I will vote no, but as a patient, I will vote yes. That puts the dilemma of over-regulation and under-regulation. Where are you going to strike this balance? Where are you going to strike this balance? Because in all common sense, if it works the second time, it should work in the first time. After all, the same human being. But if you use the exact of science, of course you can't say yes unless you've conducted the studies and actually proven it is. And this is where the challenge comes. And because of this balance between over and under regulation, now a drug from the time of conception as a concept till the time it reaches the table of a patient or the hands of a patient, on average it takes about 15 years. And I'm told in America, the American cost, the cost of developing a drug is anything from 800 million to 1 billion US dollars. When it reaches that kind of exorbitant price, one component of this exorbitant is, of course, the regulatory processes. But having said that, we cannot say just because to reduce the cost of drug production, we are going to under-regulate. So this is a challenge which we are going to discuss in the next 2 days. And I'm sure there's no easy solution to this problem. Because on one hand, we are caught with the need to ensure that patients have access to safe drugs. On the other hand, we have to also, we say, the developments of science don't impose greater strains on this process till drugs become non-available to our patients. So between these two challenges, we have to identify what is the best route. And I think this is where the whole aspect of regulation comes in. And in our country, since NPCB was first established in 1978, and subsequently to the passing of the law, that is the Control of Drugs and Cosmetic Act in 1984, and when this whole thing became more legislated in 1985, we have moved forward, and I would like to congratulate the NPCB under the leadership of Aisha for the present time. She says she had heard a lot of rumors. I'm also hearing similar rumors. But today, now we are living in an environment of rumors. So, living in an environment of rumors, we don't know what is right and what is wrong. So we leave it to the investigative agencies to tell us what is right and what is wrong. So having done that, I would like to congratulate you, congratulate the Bureau per se in recognition of WHO. WHO as a WHO collaborating center for the regulatory control of pharmaceuticals since 1996. And this is a recognition of our technical expertise and training capabilities. And I'm also informed that we have reason to be the 26th member of the Pharmaceutical Inspection Cooperation Scheme from 2002, which is an indirect recognition of our adherence to high standards of good manufacturing practice. Thanks to the industries for their compliance, if the industrial representatives from the industries are here today. And our laboratories are accredited with ISO 17025, which is another good recognition. And we are a non-OECD member whose recognition has been accepted by the OECD countries. So these all are actually bouquets to the National Pharmaceutical Control Bureau. Congratulations, you can give them a clap for their international standing and recognition, and I hope you'll continue doing this job. And we have to, of course, move forward along this line. And so while we have grown, as I was discussing with Dr. Isa and others just now we are going into the ASEAN community. And this ASEAN economic community, to actually reflect it being an economic community in reality, not only in paper. Now it looks like it will be more in paper than in reality, because every country still wants to be themselves and not really opening their heart to becoming ASEAN itself. So in trying to move forward, I think the pharmaceutical industry is one area in which there must be greater collaboration amongst the ASEAN countries, which will give us mutual benefit for the people of ASEAN as a whole, particularly in the areas of regulation, in the regulations of drug registration. But to what extent this is going to be successful will, of course, be determined by our persistence in doing it. I can understand the desire of countries to want to protect their local markets. So this is an issue which we have to confront with, and how in the greater interests of the general population of ASEAN, we will be able to move forward and give greater meaning to the idea of ASEAN as a community, so that the people of ASEAN can benefit from the experiences of its members in the regulation of the pharmaceutical industries, and be willing to recognize the standards which are set by the members in the different countries. And I hope this will be a continuing attempt, and we will be able to succeed. I think I did touch on this in your meeting in the Sunway Hotel. That was some ASEAN meeting, I think. So ASEAN meeting, I did touch on this, and I hope since then there has been improvement on this, and we will be able to move forward. Today's conference theme is transformation towards a new regulatory paradigm, which in my opinion is most apt. And in this era of globalization and with the fast pace of change occurring in the international regulatory landscape, it is essential not to merely stick to the conventional methods, but to look at new methods. Because, like what John W. Thompson said, we need to shift the paradigm from reactive technologies to more integrative solutions to deal with the variety and complexity of the threats that are out there today. This is very true. As I told you in the examples of cyclopamide and thalidomide just now, it was a reactive response. But today we have shifted from that to be a predictive response. And that onus is not easy. To go into a predictive response is not easy. And how predictive can you be? But it has always been proven that you cannot be 100% correct. But within the limitations of that, society expects us to actually give us drugs which will be free of side effects. So these are issues which we have to deal with, but sometimes some things come out of it. This drug minoxidil was initially tried as an antihypertensive drug. But the good thing about it is people who took it started to grow better hair. So eventually the growing of hair became more important than the antihypertensive elements. So now it's more a promoter, a treatment for androgenic alopecia rather than treating for antihypertension. So that is an example of a side effect which provided a positive effect. But not all often that these things happen in science, in medicine, so we have to be very careful. And sometimes, you know, some of these side effects come many, many years after the thing has come. And in these days of litigation, it can be a costly experience. It can be a very costly experience. So that is the reason if thalidomide were to be prescribed today, I woe betide the doctor who prescribed it. I think he might have to pay litigation costs for many generations to come, because that is the level at which litigation is raised. So with this kind of framework and environment, of course, it is very, very important that the onus on the regulatory authorities become much, much more important. The expectations of society as such. So I hope with this paradigm shift of an integrative solution, everybody can work together to meet up to the expectations of society and to ensure that people will be able to have good access to drugs, medications, and good, not only good, but also safe. And that is our challenge. And while we have been doing with the conventional medications, nowadays, now we have actually broadened our umbrella to include the traditional medications also. And that is another challenge. Where we put science into an area which grew purely by experience, it is a big challenge. So now trying to regulate traditional medicine, particularly it comes from so many different cultures in its diverse forms, it is a challenge. And I'm daily confronted with people who come and say, AISA has refused to register our product. Why? So we've been selling it all these years, but now we have put a label, it's good for diabetes, and they say you cannot use it. So they have to go back again. So this is a new challenge. New challenge, how we are going to handle this. Handle, because we have taken it upon our responsibility of registering traditional medicine. So while we register traditional medicine, the society outside, their perception is anything which is registered by the National Pharmaceutical Bureau is deemed safe at all cost. Whilst you will say, we are just registering it. But the perception outside is, you have given the license of safety. So you have to be able to provide that license. But the question is, are we providing the license? I will not answer that question. I will leave it to those of you who are going to discuss, I saw in your program, you're going to discuss it, to discuss this. Because the expectation, I mean, once you see this label, Kementerian Kesihatan number, whatever, oh, this is safe. That's the perception of the ordinary man in the street. So this is something which we have to deal with and make sure that the products which we are giving is sufficiently safe. The other area is, of course, food. Now some food have also become medications. There was this guy who came and saw me, he said, we got low glycemic rice. It's the same rice I'm taking every day. But suddenly the rice was low glycemic. So when he wanted to register there, of course the pharmaceutical bureau said, you cannot register low glycemic rice, which is fair. And when people want to do this, want to claim things which is beyond, it is not any new rice, not grown through any genetic modification or anything, it's the same rice. The only thing, there was we had this parboiled rice and non-rice, one which has got a higher glycemic content and lower. It has been traditional being used like that because in the parboiled they actually boil and take out the starch. And as a result of it, it has got a lower glycemic index. But that has been taken by people for hundreds of years. But suddenly some smart aleck wanted to market it by giving it a label. So when you want to give it a label, then it becomes a challenge. Are you going to do a double-blind study on taking two types of rice to see whether the glycemic index is reduced or lower? To give it its scientific component, so that you can actually label it as such. I think eventually they didn't try to do it. They're still selling the rice, of course, without the label. So this border between what is food and what is drug is also a challenge, because now food is recognized as the best medicine. So when food is recognized as a best medicine, and a lot of people actually promoting all sorts of food as preventers of all sorts of diseases, it becomes another challenge. So in this very complex environment, when you have to deal with traditional medications, food and medicines as such, and a society with very, very high expectations and very high level of knowledge. And at a time when knowledge spreads with such a rapidity, of course, we are living in challenging times. And anybody who wants to practice the art of regulation in such challenging times has got a great task ahead. So in that concept, I'm sure this need to discuss the whole concept of regulation in its overall perspective. Because you cannot become a policeman in this 100%. You have to balance between the needs of the people you are actually trying to deal with, at the same time ensure the art of this act of regulation is done in the correct and fair manner. So far the National Pharmaceutical Control Bureau has risen to the occasion, and I'm sure as you sharpen your tools, you will be able to deal with it in a better manner. With those words, I thank you very much and have great pleasure in declaring this meeting open.